What's going on, everyone? Happy Saturday to everyone. Hopefully everyone is doing safe, staying well, staying healthy. If you had to take a COVID test, hopefully you have tested negative. It is time now for the Saturday edition of the Pandemic Update for Saturday, July 29th, 2023. Taking a look today with India. India has reported 50 new COVID-19 cases with 1,456 active cases, and their fatalities have remained the same yet again at 531,915. Alrighty, we have not talked about Mpox for a little while now, and Mpox is being detected in Allegheny County, Pennsylvania for the first time this year. There is a case of Mpox, so we'll have to see. I'm not certain there's a wastewater site there for all the other stuff that we can look at, which includes Mpox. But if you recall, just recently in Youngstown, Ohio, there was Mpox being detected in wastewater. Which, Youngstown, Ohio, if you think about it, it's not all that far from the Pittsburgh area. So you got to wonder, did the person who had it in Youngstown transmit it to the person that now has it in Allegheny County, Pennsylvania? It's a possibility, and it is something to think about. So we'll be on the lookout for that there in Allegheny County, Pennsylvania. Now, this I found very interesting. Yahoo News put, coronavirus is back, but how worried should you be? And they're actually talking about coronavirus again. I was really shocked to see this. And they're actually putting tweets up from someone a lot of people should know the face here, Laura Myers on Twitter, who does. It's just a fantastic outreach person, fantastic preacher of all the risk of COVID. If you're looking for a good account to follow that tweets out news, information, COVID risk, everything, that is a person you want to be following. Very big, one of the biggest advocates in the COVID cautious community. All right, moving on to this. This is something from several months ago. I seen it tweeted on Twitter. I thought it's a good time to give you a reminder. And that reminder is, research finds COVID infection speeds up dementia progression. And this is something we've known about. I talk about long COVID and memory issues probably about once a week. I know we talked about it earlier this week. I'm going to say it again because it is worth repeating. If you have someone elderly in the household and maybe they're on the verge of Alzheimer's and dementia now, maybe they're just starting to get it, please do whatever you can to protect them, because if they get infected with COVID, it is rapidly going to accelerate their Alzheimer's and dementia issues. It's happening left and right. We know people who are reporting on who work with these patients, and it's happening. It's a real issue. Think of it this way. Someone who does not have dementia and Alzheimer's, and they catch COVID, then they have long COVID. Then they start to get brain fog and all those issues. Imagine having that issue on top of already having dementia and Alzheimer's. Just think how much worse that would be. Yes, my friends, it is happening. Alrighty, then we move on to this. COVID-19 hospitalization rates on Long Island double in the past month. This is not good, so this means the hospitalization rate in Long Island is doubling, and we're going to take a look at that today. We're going to show you. When we do New York State, we're going to click on Long Island today, and you're going to go like, what? Yes, it's rising really faster. It's more than doubled now at this point. And taking a look at this, I just tweeted this poll out about 2 hours ago now. And we are going to take a look at this again tomorrow when the results are finished. But as of right now, I put, do you think the media should go back to reporting on COVID and the risk of COVID more? And 95.3% say yes at this time. Only 4.7% say no. And that's out of 360 votes. Could this get up to 1,000 votes? I guess it's possible, and wouldn't surprise me if it does. Just by how many new subscribers I'm getting on this channel. Thank you so much for subscribing. I can just clearly tell, because I'm even getting comments saying people are just frustrated. They need a source where someone reports about what is continuing to be ongoing, the current wave. I don't even see the media mention that there's an increasing wave on TV. You watch world news, they're not talking about it. Someone is clearly saying, hey, can't be talking about that right now. It's bad for the economy. Well, guess what? Too bad. No one's paying me off not to talk about it, and I'm not going away anytime soon. I'm here for you guys. All right, moving on to this. This is a really interesting, I guess you could say, case study. You heard of the whole Barbenheimer phenomena. People are going out to see the Barbie movie and then the other movie that has to do with World War II. Well, guess what? There's a big price tag on that. It says Barbenheimer and the cost of living with COVID. This comes from Hubbub World. And they're the ones that do the data, the risk factor within the area, the prevalence. Here's what they use. And there's something big that I want to show you about this. So you know what? People are flocking to see these movies. The media is saying, ooh, look how well these movies are doing. It signals the pandemic is over. Yeah, okay, it may signal that people have returned back to not caring anymore, but it doesn't signal that the pandemic's over. Not by a long shot, as you know. And you're going to see more data today that stresses it. Cases are on the incline, and guess what? With cases being on the incline, this whole phenomenon right here is not helping. And you can see here, is Barbenheimer trending, or is Oppenheimer? Is Barbie trending, or is Oppenheimer trending in the States? And you can see pinkish purple, that's a Barbie movie, and then Oppenheimer's in the blue, and you can see it's a mix of Northeast states. A lot more people want to see about World War II. And then in the South, a lot more people want to see Barbie. Okay, but how about catching COVID at Barbenheimer? And we come down to this. Barbenheimer, the fallout. And I'm going to read a good chunk of this. Much of the population currently has low immunity. We know that. I've been talking about that lately from prior infections or COVID vaccines, making them very susceptible to new virus variants, e.g. 0.5. That's the one we're watching. We're going to actually take a look at that internationally in just a little bit. The 100,000 new COVID infections from the Barbenheimer weekend will likely result in further spread among their households. That's right, they're projecting there could be 100,000 new COVID infections just from going to see this movie. And guess what? It's going to have a pretty hefty price tag on the economy. It says 100,000 new COVID infections from the Barbenheimer weekend will likely result in further spread among their households and workplace this and next week, adding up to potentially an additional 1 million infections. Because, you catch COVID somewhere, then he passes it on to this person, and then they go take it home, and on it goes. You know how that works. It's a domino effect. Or like in a traffic jam, there's a wave. Someone puts the brake lights on, then it keeps back building and back building and back. Same thing happens with COVID infections. By the end of July, resulting in at least 1 million lost workdays, equivalent to 300 million, which is higher than the combined box office revenues of the two movies. And guess what? I can already tell you for a fact there are people taking off of work right now. No doubt about it. I'm seeing way more. The number of delivery requests that I see when I'm out, at least on Uber Eats, is way up this week. I went out this morning, I think I did 9 deliveries. All 9 of them said, non-contact, leave at door. Whenever that happens when there's a wave going on, so that's a red flag. We'll see if it happens tonight, because there's going to be storms here tonight. I'll tell you what, if I see it again, guess what that means? Yep, more people are sick, more people are having food brought in. I'm seeing grocery requests, all kinds of non-contact things, which tell me, yep, people are getting infected right now. And maybe this is part of the reason. That's probably a big part of the reason. But also, people went on summer vacations thinking all is fine and dandy, right when we have new variants coming on. Let's continue. Further, given the estimated 30% incidence of long COVID following COVID infections, we are likely to see 300,000 people experience long COVID to various extents, all because of this Barbenheimer phenomena. And it comes down here to the immediate wage loss and healthcare cost of these long COVID patients could add up to another $300 million. But there's more bad news. Though COVID treatments are now widely available, still 0.5% of the infected are hospitalized for COVID, meaning Barbenheimer could contribute to 5,000 hospitalizations at a median price of over $11,000 per hospitalization. That would amount to a total of $60 million in healthcare costs. On top of all this, given the fatality rate for COVID, the 5,000 hospitalizations could possibly lead to 400 deaths, giving Oppenheimer's famous quote, "Now I am become death, the destroyer of words," a whole new meaning. So yes, this whole Barbenheimer incident, phenomena, what's going on, people rushing, oh, I'm going to see a double feature. Guess what? It is leading to cases, and there's other stuff in here as well, like the potential amount of time of breathing air. I'm going to link this down below into today's update in the description, because this is so fascinating. We could read through the whole thing, but I think you've seen the whole key takeaway. It's leading to cases, and it's going to cost a lot of money, and I'll have more proof for you that this is definitely leading to an increase in cases, and that there is an increase in general. You'll see it in wastewater tomorrow. You'll see it in some data today. All right, moving on. We do have to take a look at air quality values, and again, air quality, it's improving, but it's still not perfect. You can see along the I-95 corridor, back down to the I-85 corridor down through Atlanta, there are some moderate areas still. The Great Lakes, finally, you're catching a break, but look at the Pacific Northwest. We do see some cautionary levels starting to come into play. Also, we have to concern ourselves that today is very hot still in the east, and it's going to remain hot in the south. There may be a slight bit of relief coming soon in the south, and if you want to see more about that, we do have a channel where we talk all about that. It's my other channel. It's called at Climate Data Report. It's all things weather. As you can see here, I talk about severe weather, weather health risk, from the heat, climate. Just yesterday, we talked about a confirmed tornado that occurred up in New Hampshire. We don't talk about that too often, but with the change in climate, things that aren't supposed to be happening in certain places are happening, such as tornadoes. Now, some are probably saying, oh, there's been tornadoes up there before. Sure, there have been, but they're becoming more frequent in New England, and that shouldn't be, and we do talk about things like that. But the key takeaway that we talk about is we give a daily weather forecast on that channel. Walgreens this week, the national positivity was 37.4%, 33.9% last week. It went up 3.5%. We'll get a new update on that again on Monday. Let's take a look at BioBot Analytics. All regions of the U.S. are rising for wastewater. We will have a full wastewater update tomorrow. I was already looking at some wastewater in my area. I just want to share this real quickly. I was looking at, this is Montgomery County, Pennsylvania, and I was looking at a site that was very near to where I actually have a pulmonary function test, keyword scheduled for Wednesday. Then I saw this. Look at the wastewater. I'm leading up to something here. If your wastewater chart, where your doctor's office that you have to go to, looks like this, cancel your appointment. Just wait it out. You may have to wait till next year at this point. We may not catch a break again till next year. So first thing Monday morning, yes, I'm calling to cancel that appointment because it's not safe right now. If anyone knows what a pulmonary function test is, it's where you have to breathe into a machine. That means maskless. I'm not doing that right now. To me, it does not feel safe to be doing that right now, so I'm canceling. Check wastewater ahead of time. There's several different sites we check. I'm going to be linking them in tomorrow's wastewater update. That's all we're doing tomorrow is just a wastewater update. I'm going to link this site, and I'll also link the other site that updates more frequently. We're going to take a look at that in a moment. And let's refresh this for a second. That way I can show you here. Let's take a look at the total breakdown. And you can see here on the right, new sites, there's 110. 0 to 19% wastewater detected for COVID, 476. 20 to 39%, 441. 40 to 59%, 230. Orange, 60 to 79%. That's up to 74 now. 80 to 100%. That's 10 sites at that. And I hate to say it, a few of them are right in my southeast Pennsylvania area. There's 2 of them here. I mean, that's why I'm canceling. I mean, it's just, It's just not safe. I saw the red flags this morning, and I'm concerned what I'm seeing. And I'll give you a coughing meter on a scale of 1 to 10. I would say right now the coughing meter, percent of people I'm hearing coughing, it's above 5. It's at least at a 6. I'd say there's at least a 50% increase in the number of people coughing this week, and that's only going to get worse. And you know what? There may be a time where I have to say, yes, more people are ordering now because they're getting sick, but is it really worth it? I may have to go back into hibernation again soon. So we'll see what happens here. Alrighty, moving on now. There's more bad news. We showed you this yesterday. Emergency department visits. All the states in the orange. They're starting to trend upward. We don't want to see upward. And there's a lot of states trending upward. We do have a lot of yellow states as well. They are stable at this time. And they could go either way. They could go down or they could go up. Chances are they're more likely to go up. We only have 6 that are down right now. Maine, New Hampshire, Vermont, Montana, Wyoming, and Arizona. Not good to see. And let's move on to this. We don't have anything today in this day in COVID history. We do tomorrow. We'll share that with the wastewater video tomorrow. We're going to probably share a couple news stories tomorrow as well, just so we don't end up finding ourselves with, oh, look at all these news stories on Monday. Like what happened last week. It all suddenly got busy. Let's take a look at a few of those other wastewater sites around the country now. Let's go back to that Youngstown area, shall we? I do want to showcase that again. Leaving myself on the left for the moment. As you can see here, COVID is upward. Influenza, not an issue. RSV, not an issue. HMPV, not an issue. But then we look again. There were 2 reading sites, or 2 dates in June. June 20th and June 21st. There was 2-day period. Look at that. It actually updated 2 days in a row. That is pretty remarkable to see. But you can see Mpox was detected. And norovirus, it was not detected at the time. It was very low. Here's Youngstown, Ohio, right? And Pittsburgh's right here. That's not terribly far away from Pittsburgh. I wish we had a site in Allegheny County on this website. I hope we see more sites pop up on this wastewater facility. There's another one down here. Let's take a look at Wheeling, West Virginia for a second. SARS-CoV-2, it is on the downward trend. Influenza, not detected. RSV, not detected. HMPV, not detected. Mpox here. This is also, again, you're within an hour of Pittsburgh. It's not detected at this time. Again, I would love to see Allegheny County, what's being detected there. Norovirus, not being detected at this time. And just for the heck of it, can we go up closer to Cleveland? We can go up to Akron. Akron's dropping at this time. Influenza not detected. RSV is detected, but it's dropping at this time. HMPV not detected. Mpox not detected here either. And norovirus, it's at lower levels, but it may be at the point where it's starting to rise again. All right, we'll take a look at some more of these wastewater sites during the week. We like to do a few each day. I thought today would be good to check the ones closest to Pittsburgh, as there is in Allegheny, Pennsylvania, an Mpox case being detected. The dominating variant in the U.S. is XBB.1.16 at 14.8%. EG.5, which we are watching, is at 11.4%. We will watch that throughout the week. Alrighty, taking a look at New Jersey. 212 hospitalizations, 5 people on a ventilator. This is not good. Hospitalizations in New Jersey, we have less hospitals reporting, 65 out of 70, and they went up on a Saturday. New York City is not far from New Jersey, but again, overall, statewide, they have gone up. We are definitely in a wave now. 21 people in the ICU. Discharges are at 24. These hospitalization numbers are only going to continue going up. Let's cross the river. Let's cross the Delaware River like Washington did. Let's check on Philadelphia. 822 EMS incidents yet again. It's been very busy, and I have seen more ambulances out and about. I saw several this morning, which is a little unusual for a Saturday morning. Usually Saturday morning's a little quieter, but again, like I said, my deliveries today, every single one of them said no contact. Some said do not ring doorbell, do not knock on door. I mean, just before I went away, half of them people were actually coming to the door. Now they're like, no, We're not going to come to the door. Just leave it there. It'll be fine. It'll be interesting tonight to see if that actually happens when there's thunderstorms about and it's raining. That is a true tale sign. Here's Montgomery County now. This is the county west of me that I do work at. Look at this. 15 EMS incidents right now. It's a whole bunch of different things. There are some accidents, drowning, so it's not all potentially COVID. And we have seen busier, but again, it's alarming to see hospitalizations continuously at such, high levels, or EMS calls. And here is Chester County. This is another suburb of Philadelphia, and we do see there are some calls there right now as well. All right, moving myself back to the right. Let's go to New York State. No update today, but I am going to show you a couple things here. First off, 586 cases reported yesterday, 9.3% positivity. 7-day average is 9%. That's way higher than we'd like to see it at. Let's go to the hospitalizations. Statewide, clearly going up. 548 in the hospital, 58 in the ICU. How about we go over to New York City now? And New York City does have 221 people in, or 229 people in the hospital, 20 people in the ICU. Now, drum roll please. Long Island. Here you go. We talked about Long Island. Look at Long Island and what's happening now. You can see Long Island is clearly going up. Look at this. It's just back on, let's see here. Back on July 3rd, they had 61 hospitalized, 9 in the ICU. Fast forward to today. 127 in the hospital, 17 in the ICU. Hospitalizations have more than doubled. Take a look at this. Admissions. This one's really alarming. Look at this. Admissions are rapidly going up. Let's go to statewide New York State. Admissions are rapidly now, they're starting to go vertical. This is not good. Are they going to get back to what we saw in the wintertime? I don't think for this wave they will, but maybe the fall waves they will. Right now, who knows? I'm not going to call how long it's going to go up, but I think what's going to happen is we could find ourselves in what happened the second half of last year. It'll go up, it'll level off, it'll drop a little, and then each time it'll, level off higher than the previous time, and then up, down, and then up, then down, and then up. And we may find ourselves in a sustained wave. This doesn't just go for New York State, around the country for the rest of the year. It's possible that happens, which is why I'm saying I think the opportunity to get an important doctor's appointment done or anything that's higher risk, I think that has now passed. Let's take a look at some international data. And today, instead of looking at cases, I thought we would just real briefly take a look at what's going on internationally on the variant standpoint. We haven't looked at this in a while. Hasn't updated since July 17th, but it did update since the last time we've taken a look at it. And the one thing we do want to take a look at is what is going on with Omicron and other variants. And you can see here, Omicron is the dominating variant in many places right now. XBB 116 and XBB 1.5. But you do see XBB 116 is starting to, be more prevalent in a lot of places. As you see here, like for example here, we're taking a look at Japan, 25%. And you can see here Singapore, 36%. United Kingdom is now up to 30% of XBB 116. But what we don't have on here is the EG.5 variant. I do think at some point they will end up adding the EG.5 variant, and surprisingly, XBB 1.5, and we can actually signal that out. Look at this here. It still dominates in the majority of the places. Then we come over here to XBB 116, which, it's getting up there, but it's not really enough to cause a huge explosion yet. However, as time goes on, it could. And when we take a look at other variants, which would probably include EG.5, I don't think it's a recombinant. If it's a recombinant variant, let me know down below. I'm not 100% certain on that, but it's not there yet in this data. The next update, we may see it start to show its ugly face. Alrighty, folks, I think I've taken up enough time for you today, and I think I've proved to you that COVID's still out there and that COVID is really starting to pick up the pace in the United States. If you like this video, give it a thumbs up. If you want to see more content like this, hit that subscribe button down below. We will have another pandemic update again on Monday. Tomorrow will be strictly wastewater. We may add one or two news stories in there if we find a lot of things and we feel it's going to turn into an event where we just have a ton of stuff to share on Monday. So stay tuned for that. And by all means, share this with anyone who needs to see it. If you know someone that's trying to find out information about what's continuing to go on with this pandemic or other viruses, by all means, share this with them and get the word out that COVID is not over. I will see you all again next time. Until I see you again next time, stay safe, everyone. Have a great afternoon.